Welcome to Level 1 Food Allergy Awareness Training for all district employees. Why do I need food allergy training? Well, Senate Bill 27 requires that all school personnel be trained. The purpose is to provide all school staff with basic knowledge and skills to identify students with possible allergic reactions to food and the appropriate emergency actions that can be taken for an allergic reaction. The CDC reports an 18% increase in food allergies between 1997 and 2007. A new 2011 study shows that 5.9 million children in the United States have a food allergy. Peanut allergies among children appear to have tripled between 1997 and 2008. Approximately 1 out of 6 food allergic children will have a reaction while at school. There are 8 foods which account for about 90% of food allergic reactions, and approximately 150 to 200 people die annually from food allergy reactions or anaphylaxis. What's the difference between food intolerance and food allergy? Well, food intolerance is an unpleasant reaction to food that, unlike a food allergy, does not involve the immune system response or the release of histamine. A common example is lactose intolerance, which may produce gastrointestinal symptoms. Food allergy, on the other hand, is a group of disorders characterized by an immunological response to a specific food protein. Food intolerance does not put a student at risk for anaphylaxis, but food allergies can put a student at risk for anaphylaxis. The 8 common foods which account for 90% of food allergic reactions include peanuts, milk, tree nuts, eggs, wheat, fish, soy, and shellfish. Other less common foods can also cause allergic reactions. Reactions can range from mild to deadly. Remember, anaphylaxis is a serious allergic reaction that's very rapid in onset and may cause death. Some of the signs and symptoms include tingling and itching of the mouth, swelling of the tongue, blue-gray color of the lips. There might be a tightening of the throat, a tickling feeling in the back of the throat, might be hoarseness or a change in voice. There could be a runny or itchy nose, redness, or swelling in the eyes, and throbbing in the ears. There's often shortness of breath, repetitive, shallow cough, and wheezing. There could be nausea, vomiting, diarrhea, or abdominal cramps. The skin may have an itchy rash or hives. There could be swelling of the face or extremities with facial flushing. And there might be a thin, weak pulse, a rapid pulse, palpitations, fainting, blueness of the lips, face or nail beds, or paleness. If you suspect anaphylaxis in a student with severe allergies, activate the anaphylaxis management plan for that student. The treatment typically involves the administration of epinephrine. Remember, anaphylaxis is a serious allergic reaction that is rapid at onset and may cause death. The treatment is epinephrine, which is usually marketed as an EpiPen or Twinjet. Remember, as in any medication, you want the right student, the right medication, the right dose, the right route, and the right time. Epinephrine is kept in the nurse's clinic in an unlocked cabinet, and it is well marked. A student may also carry an auto-injector. 911 must be called when epinephrine is administered. If there is no epinephrine, call 911. Advise the 911 operator that a student appears to be having an anaphylactic reaction and doesn't have epinephrine at school. Do not use another student's epinephrine auto-injector.
As EpiPen is currently the most common brand of epinephrine used in Massachusetts schools, we will go through the administration of self-injectable epinephrine using an EpiPen or EpiPen Junior. Please see Adrenaclick and Twinject sites for more detailed information. The first step is to remove the EpiPen from the clear outer case. With your dominant hand, the hand that you write with, hold the EpiPen, orange tip facing down. Pull off the blue safety cap with the opposite hands. Keep fingers away from the tip. Also keep your thumb away from what you think is the safety side. This decreases the risk of setting the needle off with your thumb if you are holding it in the wrong direction. Place the orange tip against the upper outer meaty portion of the thigh. If possible, administer through direct skin contact. It may be given through one layer of thin clothing. If so, make sure that contents of the pockets, seams, cargo pockets are out of the way of the needle. Push the EpiPen firmly against the thigh. This releases a short, spring-activated needle that injects the epinephrine. Be prepared for a loud click. Hold in place for 10 seconds as the epinephrine is injected. Remove the EpiPen from the thigh. There will be a small amount of fluid left in the EpiPen for product stability. Give the used EpiPen to the ambulance attendant for proper disposal. Epinephrine should be kept in an unlocked and accessible area. Avoid extreme temperatures. Keep it at around room temperature, between 59 and 86 degrees Fahrenheit. Don't store it in the glove box of a car.
Another way to remember about the auto-injector is the blue tip to the sky, the orange tip to the thigh. Blue to the sky, orange to the thigh. Students with disclosed food allergies are eligible for 504 accommodations. They will have a food allergy action plan or an emergency action plan. Once the medical information is received by the school nurse, appropriate personnel will be notified that a student has a food allergy. A severe food allergy action plan looks something like this. It gives you all the directions and it gives you something to keep in your classroom. The student picture will be up in the top right-hand corner. To reduce exposure at school, on field trips, for example, please notify the school nurse at least 2 days prior to the field trip. Of course, you can always invite the parent to attend the field trip, but don't leave for the field trip without the epinephrine. Be aware of foods that are offered on the field trip, and it's possible you may have to contact the facility in advance. Notify the transportation department that a student with food allergies who is at risk for anaphylaxis will be riding the bus, and prohibit food and drink on the bus unless the student has a specific medical order, such as a diabetic student. Campus-wide, we will have allergy-aware campuses. There also will be available allergy-free tables. Students without the allergen in their lunches may sit at the allergy-free table. In classrooms, limit the use of foods as rewards or manipulatives. At parties, please avoid foods that contain the allergen. And hand washing is always essential before and after meals, or use hand wipes. Alcohol-based hand gel is not effective in eliminating an allergen. Remember that Senate Bill 27 deals specifically with food allergies. But it's also possible that life-threatening anaphylaxis can occur after bee stings or insect bites, and occasionally after exposure to certain medications, such as penicillin. Whenever there are symptoms of severe allergic reaction, activate the emergency action plan. If you have any further questions, please contact your school nurse on your campus, and they will be happy to give you further guidance. Thank you.